Good afternoon. Another Community Champions today, and as you can see, we're not where we usually are. We're not at Chamber House, but we're at Hospice Taranaki, and I have with me Paul Lamb. Hi, how are you?
Hi Maura, great for you to be joining us today. Welcome to Te Rangamāori, which is our care centre for our inpatient service in New Plymouth. It's great to have you with us.
And tell us, Paul, what is hospice all about? We know what for people for inpatient care, but what's the whole bigger picture of what you do?
Great question. So our organisation has been in the community for 33 years, and we are the sole provider of palliative and end-of-life care across the province. So our work is around being with patients when they have an end-of-life diagnosis and saying to them, what are the things you want us to do? What are the care decisions you want us to provide for you? And more importantly, where do you want that to be delivered and who with? So hospice care is a holistic form of care, which is not just doctors and nurses, but we have a support team around them for counselling staff, spiritual advisors, social workers, and we bring an entire service to what your needs are.
How many people are in the community that...
We have at present 285 patients being actively cared for right across Taranaki. So as a proportion of population, not many patients come into the space that we're talking in. We're a bit like the tip of an iceberg, the majority of our work being done in the community and in patients' homes. And as well as taking our care to that space, we take whatever care equipment they need, which is loaned by us for the time that they need it.
So beds and chairs and...
So most commonly that specialised beds and mattresses, but it might be shower chairs, it might be commodes, it might be walking aids, it might be specialised seat cushions, and all those things are a part of having a patient living as well as they can be, enabling them to make as many choices as they can be, but really living life on their terms and their environment.
So of course this involves nurses, medical professionals, doctors.
So we have our own team of nurses and doctors. Overall our organisation has 110 staff at present, and approximately 2/3 of they would be involved in our care service. So as well as our own doctors and nurses, we have, as I was saying earlier, our own social workers, spiritual care advisors, our own counselling team, which is a very key part of our business. And the balance of our staff are in our charity retail group, which exists to help fund our care services.
And tell us about the charity, that side of things that helps you fund.
It's not a place for the faint-hearted working in the charity healthcare sector, and we're continually fighting financial constraints and getting our voice heard in the community. So we operate a 6-site retail charity group, and that's right across the province, and that's a vital connection for us into the community for really a window of what our organisation does, but it's a key part of our fundraising activities each year. That's where the majority of our 450 volunteers support us.
And if someone wanted to volunteer, how would they go about that?
A number of ways they can contact us. Through our website probably is their best way.
Right.
We get a lot of people walk up and say, look, I've been connected to your service, or I think I've got some skills and abilities. Can I do something that might be of value to you? And we have a wide range of volunteer activities. Right across our retail group, we have volunteer activities within our care service in the building that we're sitting in, and we're always looking for more volunteers to join our teams, and there's lots of opportunities. So really it's give us a call, go to the website, or knock on a door and come and see us.
Obviously you need a lot of funding. That's why you do the fundraising, that's why you have the shops, and you have little projects. I note that there was a project recently for meals for patients in this facility, and other things. You had your antique show. What other projects have you got on the go at the moment?
A lot of our work is around creating better community partnerships, and our organisation is the strength that it is over the years that it has been, through having strands like parts of a web. We have connections to so many groups and organisations that keep supporting our work. So a big focus of our work at present is actually making those partnerships stronger.
Yeah.
And we realise in 2025 we can't come along like Oliver Twist and say, here's the begging bowl, can I have some more please? We've got to be able to add value in a sense that what can we provide somebody that's able to provide their services or their funding to us? And that's I guess a different way of thinking for us. I mean, we have a huge number of volunteers, a large number of staff. How do we partner with community groups that may choose to be able to be part of what we do? How do we also add value back into their organisation?
So you're looking for partners that you can align with,
yes,
according to values, and I guess with many businesses there will be many people within their organisation, within their employees who have had part to do with hospice.
Yeah.
So there'd be a lot of people who would combine with that. But so for the people listening, that you'd like people to contact you to hear about how they can align with you, the different projects that are available, or you'd like to be able to get out and talk with others?
Look, absolutely, we would do. Not every one of our community supporters is someone that funds us for huge amounts of money or services each year. We exist
Any
as
amount,
any amount we can work to. Many people provide services that we can avoid that cost and use that funding elsewhere. We actively encourage our large group of staff and volunteers to support those that support us. So for us, it's about working with groups that have similar values in the way that they work. And I speak to many community groups, and I can't think of one in the 8 years I've been in this role where someone's not come and said to me, I remember when my mum, my dad, my partner, my granddad was in your care and the differences that we made. That's us getting our work right when we can do that. And that helps us having those ongoing relationships in the community.
So Paul, hospice has a high profile as an organisation. You've got shops, you've got a lot of things going on that are funding you. So for the average person, and I have to confess I was one of them, you could think that you're pretty well funded, that the needs aren't so great. Is this the case? And if not, how can people be part of your answer?
Sadly, it's not the case, and it is. I spend a disproportionate amount of my time talking about finances in the organisation. So each year we fundraise around $5 million from our communities.
Wow.
So the majority of that comes from our retail group, which is probably the most well-known part. But our government funding this year covers 53% of our care services, so the balance to maintain doing what we're doing in the ways we do, we fundraise ourselves. So as well as our shops, we have fundraising events during the year. Organisations come to us saying, can we do this event to raise funds for you? We have people that leave us bequests, which is fantastic when they do. People fund pieces of equipment for us. People will come and volunteer to do something or provide a service in regard of perhaps some contact they've had with us. And we are constantly working with central government around funding models to help us have sustainable futures. But it's a complex part of my work, and it's one of the connections in the community that's so important, that we are so well supported to raise that level of funds.
And so the short answer is you need funding. You need whatever people can do, whatever creative ideas they can come up with. You want to hear about it.
Absolutely. We've done some very unusual things in the form of fundraising, and we don't say no to anything without a very, very careful look. And we're just lucky to have such a wonderful community that can respond to us in that way.
Because it's hard to think, with the care that you give, with the absolute huge need that there is of the care, that you're fundraising for half of it. So certainly the community is such an integral part of that.
Absolutely, and our community relationships and telling our stories and our partnerships are a very underpinning part of that. They'll be part of our future success for sure.
Yes, great. Well, you certainly all do a fantastic job, and you know, even to have that bridge between hospital and end-of-life care, and having people who understand the real intensity of what that can be like for people, is just something that our community can't have enough of. So we just really appreciate what you do, what your staff, what the volunteers, and just really hope that you can get a whole lot of partnership engagement where people can really see what you're doing and the value that you add to this community. So we'll keep working on that. That's what the Chamber wants to do through Circulators, to connect business with our valuable community organisations, of which hospice is very high on the list. And so thank you so much, Paul.
Thanks for the opportunity. We think it's great being part of the Chamber and the opportunities it provides us, and look forward to more of them. So thanks for your interest, Maureen. It's great to see you again.
You too.